Breakfast with Spaniels with Dr. Judy Morgan.
All right, let's see if our equipment is going to work today. Okay, it sounds like it's working. Good morning. Oh wow, lots of you are right on time. That's impressive. Oh, you got the notification. Yay!
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
All right, good morning, everyone. So I'm using a different camera and microphone this time to see if we can improve the quality a little bit, but I think now my Wi-Fi is probably what's going to slow us up. But anyway, we're making improvements. And Marvin, I wanted Marvin to be on this morning because I think my dad is going to take him back in the next week or two. So we won't be seeing Marvin as much, but I'll make sure that we stay in contact. I'll obviously see my dad quite often. But he's exploring right now. This is now the bird room, so he's having a good time. Okay, so I'll start with some updates to give people a chance to log in, and then we are going to talk today about the culture and sensitivity results of Max, the horse. But it's a really good case in point as to why you should do a culture and sensitivity. So I think this is a really important topic today. For those of you that saw all the chaos going on, we do have goats now in my backyard. So I live on a full acre on the outskirts of Raleigh. So we are actually zoned agricultural residential. So a bunch of our neighbors have chickens and a bunch of small farm animals out here. And so we now have half of our yard is for goats and half of our yard is for dogs. So we're goat farmers now here. But they're doing really well. The vet that came out over the weekend, when they showed up in the middle of the night in a dog crate, like a metal, like kind of like that, the metal wire dog crate in the back of a pickup truck. And they were like that for 2 hours down the highway coming to my house in the middle of the night. Yes. So when they showed up, I was like, what is this? First of all. Second of all, they were tiny, tiny babies, the two twins, and much younger than I thought they were in the pictures. And so I was terrified. You know, it's the middle of the night. I have these sick baby goats. I was like, oh man, are they going to even make it through the night? So first thing in the morning, Saturday, we called out a vet that does everything with hooves. So she does goats, llamas, alpacas, horses, goats, cows, pigs, everything. Super awesome. Open to the integrative and holistic philosophies, which is very rare to find in this area. Just really amazing. Her name is Dr. Swink. So if you're in the Raleigh area and you have anything with hooves, highly recommend her. She was really, really great. And so she immediately came out. We got them loaded up on vitamins and antibiotics, all sorts of stuff. Dewormer, they had pretty significant parasites. They had external parasites and internal parasites, but they're doing absolutely amazing. They're gaining weight and growing, eating, drinking really well, and they seem to really love my backyard. So the goats are doing amazing. We're having a great time. And Mila, the little couch potato, is exhausted because she has taken on the role of goat guardian. So she will go out on the back porch and just sit at attention, making sure the goats are okay. And if they get out of her eyesight, which they can go under the porch and climb on the porch and all sorts of stuff. If they get out of her eyesight, she will start barking and alerting us like, I can't see the goats. So poor Mila, she's exhausted. She normally is a couch potato, but she is taking her role of guarding the goats very seriously. So anyway, and of course the new puppy that you all saw yesterday is just the cutest thing on planet Earth, I think. All right, so now that we got the updates out of the way, it looks like we've got quite a few people. I wanted to talk today about this case that we had with basically upper respiratory infections with our equines. So to fill some of you in, we had rescued 5 donkeys and hinnies from a really bad situation back in April. They all came, of course, they had the snotty noses, they had coughs, they had fevers, they were really, really sick when they showed up. And so when we had to call the vet out immediately, and it was a really urgent situation where they looked just really sick. Their vitals were not great. So we immediately injected them with an antibiotic for equines called Exceed. And it's Ceftiafor is the actual name of it, but it's very common now with equines, and I found out on Saturday they use it in goats apparently too sometimes. So anyway, that was an urgent situation where we needed to treat them immediately. They had high fevers, labored breathing, they had high heart rates, so it really wasn't a case where we could have waited. Same thing with Jasmine Donkey with her pneumonia. As soon as she showed up to NC State, they loaded her up on antibiotics because she was really, really sick. And sometimes that happens. So that's what we did back in late April, May. All of them made full recoveries. The snot dried up, the cough got better, their fevers came down. They went through 30 days of quarantine. And we were pretty confident, hey, this antibiotic did a great job, kicked the upper respiratory infections out of their system, and we thought we were good to go. Now, a few months later, we had noticed a little bit of nasal discharge from one of the other miniature horses. And so we weren't sure exactly what was causing it, but there wasn't a fever, there wasn't any other symptoms. So we were like, it could be a little bit of dust or agitation in the sinuses, or this could be viral or bacterial. So we started to notice a little bit of the symptoms coming back for one of the animals. And then about, I guess at this point, a month ago, Brandon's horse, who is the big Clydesdale, Max, he's beautiful, he started blowing a lot of bright yellow snot out of his sinuses. And we said, oh, wait a minute. Whatever we had with the donkeys in the beginning a few months ago, it seems like it's coming back, or we didn't fully eradicate it the first time, even though symptoms cleared up, which can happen. And so I immediately, because we had thought, or we had eradicated it with the donkeys, I immediately told Brandon, I said, hey, we have to do a culture on this snot to figure out what bacteria is growing, because I am pretty convinced that this is the same thing the donkeys had, and we probably just did not fully eradicate it the first time. So of course, when the vet came out, they wanted to just inject him with this antibiotic called Exceed. And if you take your animal to the veterinarian for something like a urinary tract infection or upper respiratory infection, you may experience that your vet is very eager to just give you antibiotics. I experienced this firsthand with my cat that was urinating outside the litter box. I took her to the specialty center because I wanted all the diagnostics, and they have the ultrasound and x-ray and everything right there. And immediately they said, oh, well, what you're describing sounds like a urinary tract infection, and you seem pretty knowledgeable, so we'll just give you Clavamox. And I was like, what? Like, there's so many things that can cause a cat to urinate outside the litter box. I'm not just gonna, load up this senior cat with a history of GI issues with antibiotics just because I said she pees outside the litter box, right? So Same thing with our horse. We hadn't even confirmed yet if it was viral or bacterial, because obviously if this was a viral infection, antibiotics aren't going to eradicate it either. So we insisted on doing a culture. And so when you're doing a culture, whether it's a urine culture, so your pet is exhibiting potential signs of a UTI, or they find some bacteria in their urine, or in this case, it was an upper respiratory infection. So we wanted to culture the sinuses of our horse. It's really important that your veterinarian gets as clean of a sample as possible. So for urine, that means actually extracting the urine with a needle. It's called a cystocentesis. I always just say cysto, so I think that's correct. And so they go in actually with a needle and extract the urine straight from your pet's bladder. The reason why that's really important is because when you're doing free catch, if you're just catching while they're urinating normally, you can actually contaminate the sample with bacteria, because bacteria is everywhere. It's on our hands, it's in our sinuses, it's in our mouth, it's in our gut. There are good sources of bacteria that are everywhere, but you don't want to contaminate that culture sample, because what they're going to do when you send that to the lab is they're going to see what bacteria grows. So you want it to be the cleanest sample as possible, so that way you know what grows is actually causing the issue that you're testing for. So we insisted that the vet do a culture. In this case, she stuck a really long swab as far up into his sinuses as she could to try to get a clean sample, because obviously around the nostrils, there's going to be a lot of contamination with a bunch of different types of bacteria that are naturally occurring in the environment. And she sent that off to the lab. Now, as I had explained in the first situation with the donkeys, and there are situations like this with our cats and dogs as well, sometimes if it's urgent, you do need to start treating with an antibiotic, a broad spectrum antibiotic. And if the culture results come back and say that you need to use a different antibiotic, then at that time they'll typically switch or add it on, or whatever the protocol is. However, if you can wait for the culture results, whether urine culture, this is a sinus culture, if you can, it is best ideally to wait to see what you're dealing with, because then you are not basically treating an animal with an antibiotic for a few days. You're doing nothing but basically introducing that antibiotic into the pet's system and potentially teaching the other bacteria to become resistant. And you're not actually treating the root cause of the issue. And then you switch, 3 to 5 days later when you get the culture results. So with Max, our horse, he's our youngest. He's only 6 years old, very healthy, has a great appetite. And so he had the snot and the cough, and he had a very, very low grade fever, but he didn't spike a high fever, and he was still eating and drinking. He was a little lethargic. You could tell he wasn't feeling great, but he was not acting super sick or uncomfortable. So we felt confident that we could do the culture results first. If he did get worse, we agreed that we would, of course, treat him with antibiotics while we were waiting. But we just monitored him multiple times a day, monitored his temperature and his vitals to make sure that he wasn't distressed or getting significantly worse. And we were able to wait. It took like 5 days because it was over the weekend, but typically they're 3 to 5 days. And we were able to wait until we got the culture results to make a decision on the antibiotic, because his body was actually fighting it off pretty well. And during that time, of course, we supported his immune system. The colostrum that's on the website, all of our equines got that. The Symbiota, which has the soil-based probiotics and chaga mushrooms, he got those as well. We added on some Chinese herbs to try to help drain the sinuses and support his immune system. So while we were waiting for the culture results, we were able to do a lot of more natural and holistic things to support him and his body while he was fighting off this infection. So I want to show you actually what the culture and sensitivity results look like. Because in his case, this is the perfect example. Oops, why can I never remember how to do this? Here we go. Okay, so This is through the lab Antec, which is pretty common. They use Antec as well for small animals. So you may, if you've gotten a copy of your pet's lab results, which I highly recommend doing every single time, you can just, most places you can just say, hey, can you please email me all the results? And a lot of the things are online now, so they can do that pretty easily. But this is what our culture and sensitivity results looked like. So the culture part of the culture and sensitivity is seeing what bacteria grows from the sample. So that basically is going to tell us what bacteria is most likely causing the issue that we're dealing with. Then the sensitivity part actually tells you whether or not it is sensitive or resistant to various types of antibiotics. So that's why a culture and sensitivity is so powerful and so much information, because not only does it tell you the type of bacteria, but it actually tells you what antibiotic can be used to eradicate this infection, right? So that's why we preach all the time to get the culture and sensitivity, because it is so much key information when treating your animal, assuming there is an infection. Now, if it's viral, of course, your culture's not going to grow anything. So this is what it looks like, and briefly I'll just point out the important parts. So here under organism, let me see if I can make this a little bit bigger, easier to see. Here we go. Okay, hopefully that's a little bit easier to see. So you can see under the culture organism, number one, heavy growth of Pseudomonas. And so as soon as I saw this, I said, okay, this all makes sense. So Pseudomonas is actually a bacteria that can be a little bit more challenging to treat because it has become more resistant to many common antibiotics. So there's tons of different types of bacteria that you might see. In our case, this is Pseudomonas that we're dealing with. In like a cat's urine culture, often you'll see E. coli, that's pretty common, but down underneath the culture results, you'll see if there is any growth, you'll see the name of the bacteria or the type of the bacteria. Then the top, which is also really, really important information here, is you'll see, so this list is list of antibiotics. And then they do basically 3 trials to see whether it's sensitive or resistant. So you can see wherever there's an S, it was sensitive to that antibiotic, and wherever there's an R, it was resistant. So if we go through these results, the only ones that were sensitive all 3 times were the ceftiophore, which is the Exceed, enrofloxacin, which is Baytril, there's the ticarcillin, which I actually haven't heard of, carbenicillin, and I think that's it. So as you can see, out of that whole list of antibiotics, there's only a few that actually were able to treat the Pseudomonas culture that we sent in from our horse's sinus cavity. So that really, to me, that explains. So the ceftiophore is the Exceed that we had treated the donkeys with. And so you can see in this case, it actually says that it is sensitive to ceftiophore, the Exceed. And so that's when the wheels in my head started turning. I'm like, okay, if this is sensitive to the Exceed, and all of them got Exceed in the beginning, the donkeys that brought this bacterial infection into the farm, then why didn't we eradicate it? So I started digging a little further, and I looked up, all these drugs have like the drug inserts that give you a lot more information. So I just Googled Exceed, ceftiophore, which is like the actual name of it, and Pseudomonas, and this is what I got. So this is the insert. Let me show you the important part here, which in the insert under microbiology, it literally says ceftiophore is not active against Pseudomonas. So even though in this case, our culture and sensitivity is telling us we have Pseudomonas, saying ceftiophore is actually, it is actually sensitive to the Exceed in this particular case. However, it says in general, They don't recommend using Exceed for Pseudomonas because it's not actually active against it. So now I felt like a detective. I was like, yes, I figured it out, right? So what probably happened was we treated 5 animals with the Exceed. And it obviously worked for some of them. Like the baby donkey was very, very sick and he made a full recovery. So it obviously worked in some cases, but in other cases, it didn't fully eradicate the bacteria. And so having all this information, of course, since it came up on the culture and sensitivity, it said that ceftiofur was sensitive across 3 different trials. And so the veterinarian saw that and she immediately said, oh, well, it's sensitive, so why don't we treat him with Exceed? And I said, well, in this case, it says Exceed should not be used against Pseudomonas because it's not actually active against it. And we already have previous experience with using Exceed with this bacteria on other animals, and we know that obviously it wasn't able to completely eradicate it because here I have another animal that has popped up a few months later with this issue. So that was when, of course, I talked to my mom and I said, hey, I don't feel comfortable using Exceed here because it obviously didn't eradicate the bacteria, and the pamphlet literally says do not use with Pseudomonas. And so enrofloxacin is actually Baytril, and she said, oh, well, when I was dealing with Pseudomonas with small animals, often we would use enrofloxacin with pretty good success. And so I did another Google search, and I just said, enrofloxacin and actually, let me just do it. Enrofloxacin and Pseudomonas. And so you'll see like the first, page of results is all about how enrofloxacin is generally used to treat Pseudomonas, and it's generally sensitive to it. So I had her, of course, firsthand experience, but me just as a pet owner, doing some quick Google searches, I felt much more comfortable choosing the enrofloxacin, which is Baytril, for our horse. So I requested that we use that antibiotic. The veterinarian agreed and said, yeah, that sounds like a good idea. So we ordered the Baytril, and within 2 days of treating my horse with the Baytril, which is 30 mLs of liquid every day, the snot cleared up, the cough went away, his low-grade fever completely went away, and he immediately showed big signs of improvement within a day or 2 of treating. And so now he's completely back to normal. But this I thought was a super interesting case because we had the culture and sensitivity results, which looking back, I wish we had done the culture the first time with the donkeys. As soon as we decided to treat with antibiotics, I wish that we had done a culture, because then we would have had this information months ago and we could have eradicated it and chosen the correct antibiotic. However, it may have shown up on the first culture that it was sensitive to the Exceed, and we may have, taken the same exact steps that we ended up doing. But either way, the culture and sensitivity in this case is really, really what was a game changer in our treatment, because we literally had to kind of piece together this puzzle of, okay, we know it's this bacteria. We know that it didn't work with Exceed before. So even though it is showing as sensitive on our sensitivity, maybe it's a wiser choice to pick a different antibiotic that has a better track record with treating Pseudomonas. So this was an absolutely amazing case of the power of a culture and sensitivity, and how you as a pet parent can advocate for your animal with just a little bit of research. And of course, for me, I felt I felt a little frustrated, where I was like, why am I the one, doing all this detective work, and why am I the one, requesting that all these things be done, and picking the medication and things like that. But at the same time, I feel like in this day and age, when we're seeing all this data of veterinarians, unfortunately, either overusing or inappropriately prescribing antibiotics. So I've really sort of taken the stance of, yes, that's an issue that we need to address with the veterinarians, of course. And there's people like Dr. Dan Taylor that are investing, basically his career into doing that. Oh, hello, Edward. But I think we as pet parents, we have to be armed with this information and this knowledge so that way we can advocate for our animals. And I'm not a veterinarian, but with just a little bit of research and a little bit of education, I was able to advocate for my pet. And I was able to say, hey, this doesn't make sense to me. Are there other options? Or I looked in the pamphlet for the Exceed and it says not to use it. Can we use another option? And so it doesn't have to be a battle with your veterinarian. I mean, our veterinarian was super nice and she was like, oh, you know what? Like I agree with you. This makes sense. Let's do it. So it doesn't have to be a battle. It can be a conversation, but I think as pet parents, it's really, really important that we learn more about these things because I had to request a culture. I had to request the medication being used. I had to request that we wait to see what the culture results were before treating the animal. And so a lot of this came from me being empowered and me feeling confident that I was making the right decisions for my animal. And of course, there's going to be, like I said, there's situations, of course, where you have to treat with antibiotics immediately. I'm not talking about those scenarios because, you got to do what you got to do in case of emergency. But in this case, he was completely stable. We were able to support his immune system really well to fight off the infection while we were waiting. So anyway, my house is a zoo. I have a dog, a cat, a bird, goats, whatever. Okay. So, your enrofloxacin is what your dog has been on for Pseudomonas. Yeah, it's apparently pretty typical to use. Yeah, I'm basically a detective. Yeah. Sometimes you have to be though, in my experience. And oh God, I get so frustrated because I'm just like, I'm not a veterinarian and obviously I care a lot about my animals and, I care a lot about veterinarians and I don't want to be rude. I don't want to just go and be like, you don't know what you're talking about. I read on the internet that we should do something different. Of course, I don't want to be that person, but I also have to advocate for my pet. And so luckily with many of the veterinarians, I just explain and I'll say, look, I'm just really concerned about my animal. I want to do what's best for them. I have some questions because, I read this and that and I feel uncomfortable with the current treatment plan. Can we talk about it? And they've been pretty nice about it. Okay. Okay. Yeah, so some people were saying they couldn't see it, but if you're interested, I could always post this later as well. So, and of course, if any of you, if it's, something that's really time sensitive, like you're at the veterinarian, unfortunately, there's nothing we can do to help you immediately in the moment. But feel free to email us and, ask us questions if you're saying like, hey, we get this question a lot. Like my vet did a urinalysis, showed some bacteria, so they put them on a broad spectrum antibiotic. And we'll say, okay, you need to request a culture and sensitivity to make sure that even though your pet is on antibiotics, that you know what the bacteria is and you know if you are using the correct antibiotic. Because what happens is, just like with us, you can think that you eradicated the infection, but really you just kind of damaged it, but you didn't completely eradicate it, and then it can come back again. Or it can just be the complete wrong antibiotic, which we've seen, unfortunately, many times, where your pet does a full 7 to 10 days of antibiotics. After the 7 to 10 days, there's no improvement, and then you have to go on another antibiotic. We had one client that their vet never did a urine culture. They just did a urinalysis. It saw some bacteria. So they just started with an antibiotic, and that didn't work. So then instead of doing a urine culture at that point, they just switched to a different antibiotic, and that didn't work. And then they were going to do a third round of antibiotics without doing a urine culture. And I was just like, you need to advocate for your pet and request a urine culture, because obviously what is going on here is not treating your pet. It's just making the problem worse. So we see that, unfortunately, quite a bit. All right. Yep, absolutely. We are their voice. We have to be. And unfortunately, now you have to be pretty educated. You have to kind of know what you're talking about. All right. So that's my soapbox for today. Being your pet's advocate and a little bit of a detective. If you're like me and you're a crazy animal lover. Hi, Marvin. Hey, buddy. You're such a mess, Marv. Hey, buddy. Oh, and one question I just saw is what did we give our horse while he was on antibiotics? So the main thing that we're giving him still the colostrum. There's a dog and an equine version on the website. The Symbiota, there's a dog and an equine version. He got both of those, and he's on some Chinese herbs as well to boost his immune system. All right, everyone have a wonderful day. And we will see you tomorrow don't forget, tomorrow is a special live on herb gardens for cats. It is absolutely, I'm really, really excited. It's a super fascinating topic. So join us tomorrow at 8 a.m. For Dr. Judy and our special guest. All right, have a good day, everyone.